Well, we're back to our introduction on medical terminology one, and we've talked about rules and how to put words together and word roots and combining forms and combining vowels. We spent some time talking about suffixes, which always follow a word root. We talked about prefixes. There are three areas that we haven't talked about in the beginning talks about medical terminology. And the first is abbreviations, but we're going to wait for abbreviations when to get to each individual section. We'll give you a group of related abbreviations that are for each individual section of the body that we talk about. Um, there are what we consider approved abbreviations. A lot of people make their own abbreviations, but in a court of law, they don't stand up, or in a hospital, they don't stand up. So there are some approved abbreviations, and we'll be giving you some of those approved abbreviations throughout the whole semester. Second area we haven't really talked about are plurals. Sometimes many of the words we discuss will be in singular form, but we might have plurals. And so we'll be talking in another video in regards to how we turn a word from a singular form into a plural form. But what we want to talk about today is the third thing, and these are some guidelines or some rules for pronunciation of things. So we really want to talk about some pronunciation rules here to help you, because again, I mentioned at the very beginning when we talked about what's medical terminology all about, talked about how the fact that the medical terminology is not just a written language, but it's also a spoken language. So we have to be able to pronounce things right, And every so often, that's why I hate watching some of these medical shows. I mean, you watch Grey's Anatomy and all these other goofy things, and people are pronouncing things wrong all the time. It makes me break out in hives, and I just don't want to watch anymore. So let's talk about some pronunciation rules here. We'll go through a number of these. So first of all is the F sound. Okay, the F sound. The F sound. Yeah, if the word begins with an F, okay, if the word begins with an F, or sometimes if the word begins with a PH, it's a typical. Okay, some examples of that would be femur. Femur, typical, begins with an F, starts with a F sound. Femur, piece of cake, easy. Femoral popliteal, again, we go back to our femur here. So femoral popliteal. Now this word right here it's a long word, and it's really sort of a complex word. It's called a pheochromocytoma. Again, we have a PH. Again, this is a lot of things we have in English as well. General English language, not necessarily medical terminology. This is a very interesting thing, this pheochromocytoma. It's actually a tumor of the adrenal gland. It produces a lot of epinephrine abnormally, and people have these, panic attacks, or their blood pressure goes way up, the heart rate goes up, and stuff like that, just without much provocation sometimes. But anyway, that's beside the point. It's called a pheochromocytoma because again we have that F sound if the word begins with either an F or a PH. The J sound, J sound. If the word begins with a J, or if the word begins with a G, and that G is followed by an E, I, or Y, it's a typical J with a soft G sound. So the J sound is basically a soft G sound. There are a couple exceptions to this rule. Okay, now here's a word right here, which is a G followed by a Y, and that's not gynecology. That might be something, mixing drinks or something like that, but that's not the case. This is gynecology. So this is one of the exceptions, but it's more the exception of the rule as compared to the true rule. Now here's a word, okay, that begins with a J, and it's followed by an E, and that would be pronounced jejunum. Jejunum. The jejunum is actually the second portion of the small intestine. It's a pretty good long piece, but it's the second portion of the small intestine. A J followed by an E, which basically is jejunum. Geriatric. Here's a G followed by an E. Okay, geriatric. Everybody can figure that one out. Here's a G followed by an I. Gingival. Gingival. Gingival means pertaining to the gums. Gingiva are the gums, so gingival will be AL, pertaining to gingival, gingival pertaining to the gums. Okay, this one right here, gyrus. Gyrus. Here's a G followed by a Y. Okay, that's gyrus. If you look at the brain has all these lumps and these little creases. Each of these creases right here is called a gyrus. So these are some typical examples of the J sound or the J sound, soft G sound. If it's a J or a G followed by an E, an I, or a Y, it's usually, again, not always, because we have this exception right here, mostly a J, jejunum, geriatric, gingival, gyrus. Okay, the hard G sound would be the G, G. And that's the word element ends in G and followed by an A or an O. Okay, and this is the hard G sound. Let's look at some examples of this. Selpingalgia, selpingalgia. So here's a G followed by an A, selpingalgia, not selpingalgia, but selpingalgia. Selpingo means the fallopian tubes. Algia we know means pain. Is the word that we had before in our suffixes. So selpingalgia. Laryngoscope. Here's a G followed by an O. Laryngoscope, not laryngoscope. So laryngoscope, a hard G or G sound. Okay, laryngoscope. Okay. Another hard G sound would be if a word element begins in G and is followed by a consonant. Okay, it's typical G sound as well. Let's get some examples of that. Glossitis, glossitis. Okay, so glossitis, glossitis. Glossitis, glosso means tongue. So itis we know means inflammation. I see how easy these medical words are to put together. So glossitis would be an inflammation of the tongue. Some nutritional deficiencies, some diseases will cause a glossitis. So glossitis is a glossitis. Glomerulonephritis, glomerulonephritis. So here's a G again followed by an L. And glomerulus is basically a ball of capillaries in the kidneys. We'll be talking about those near the end of the semester. And nephritis, nephr means what? Kidney, and itis means inflammation. So this is an inflammation of this ball of capillaries that does all the filtration of the kidneys. So that's glomerulonephritis. Again, G sound, the hard G sound. The K sound. If a word begins with a K, there are some exceptions, like here's one, knee. It's not knee, it's knee, okay? Or if the word begins with a QU, okay? Some words that begin with a C, again, that's some words, and some words that begin with a CH, it's a typical sound, okay? Kyphosis, kyphosis. So here's a K, okay? Kyphosis. Kyphosis would be that big humpback. When somebody has a large humpback, frequently happens in elderly females or people with osteoporosis. The vertebrae become very soft, and sometimes with coughing, sneezing, straining, having a bad bowel movement, whatever the case may be, the vertebrae, instead of being sort of like a block, will actually crunch down. And as a result, when it crunches down, it's like this, one on top of it like this, crunches down and gives this large, big hump at the back. So this would be toward the front of the body. This would be towards the back of the body. So this is called a kyphosis. So kyphosis, typical sound. Quadriplegia, that's the word we talked about before. So here's a QU, okay? Quadriplegia. Again, starts with a quadriplegia, okay? Piece of cake, easy. Cornea, cornea. Cornea is the clear portion, it's a membrane at the front of the eye, okay? Sometimes when people get a little piece of sand in there, they get a little irritation. I can feel that. And that's just called a corneal abrasion. Corneal abrasion, AL, adjective suffix, abrasion would be the noun. Now this right here is a not following the rule. That's not celiac, but the true word or the pronunciation of this would be celiac. So again, some words that begin with a C, like cornea, will have the K sound, but then other words that begin with a C start with a softer C, celiac. Okay, that's that. And then we have chondroma. Chondroma. Here's a C and a CH. So here's a CH, chondroma. Oma we know means tumor. Chondr means cartilage. So chondroma would be a cartilage tumor. And again, because it's a CH, it's one of those words that starts with a sound, a hard C sound. Now this word over here is not Charcot, but Charcot. Charcot. Charcot is a situation where people with diabetes, what happens is the blood supply to the bone changes a lot. And what happens is the bone in the mid portion of the foot, most common area, just collapses. And these people end up with a very blocky looking foot. It's sometimes called a cube foot, where the forefoot and the rear foot just smash on each other. They have this really large, unusual foot. Sometimes they have big, sometimes the bottom of the foot is actually sort of rounded this way instead of being flat, or instead of having an arch, it's the other way. This would be called a rocker bottom foot. And that's because the midfoot collapses by the fractures that we get. But again, that's not a hard K sound, that's a Charcot. So we have a chondroma, which is the typical K sound, but Charcot, which does not follow that particular rule. N sound, okay? Words that begin with an N, some words that begin with a PN, and some words that begin with a K. And again, some of these are sort of like, some, I don't know. This is the typical N sound, okay? Neonate. Neo means new. Nate means newborn or born. Okay, natal. Natal is a word that means birth. So neonate would be a newborn. So that's a typical word. Begins with a neonate, typical N sound. Pneumonitis. So here's a PN sound. It begins pneumonitis with a typical N sound. Itis, inflammation. Pneumo means lung. So pneumonitis is basically another word for pneumonia. It's a medical term for pneumonia. Okay. Knee. Again, here's a KN. Sounds like a knee, not a knee, but a knee. Okay, so that's a KN. That's the typical N sound that we have there. The S sound. The S sound. These are for words that begin with an S. Some words, a word that begins with a PS, and some words that begin with a C. Okay, and that's a typical S sound. Okay. Sarcoma. Oma means tumor. Sarc means skeletal muscle. So basically, sarcoma would be a tumor that involves in some way the skeletal muscle, also involves the adjacent bone, but called sarcoma. Again, begins with a typical S sound. Now this word right here, PS, okay, and this is psoriasis, not psora, not psa, but psoriasis. And psoriasis is basically a really interesting type of connective tissue dermatological disorder. Psoriasis involves the skin, but also involves other places, frequently the joints. If you watch, what's the golfer? I forget what his name is, but I'm not really much of a golf fan. But the one golfer that basically is, his daughter draws pictures of him and stuff like that, and he has psoriasis. And psoriatic arthritis can be actually really, really significant. It could be as bad and frequently as deforming as rheumatoid arthritis. But getting back to what we're talking about, here's a word that begins with PS and has the typical sound. So psoriasis. People with psoriasis, by the way, have a tendency to do better in the summer. Ultraviolet light makes it better. In colder temperatures, again, the ultraviolet light, they're inside something that don't get as much exposure to the ultraviolet light, and it seems to flare a lot more. Also, they use a lot of tar-based preparations on these, and sometimes that gets activated by the sunlight or ultraviolet light that helps a lot too in regards to clearing things up. Now, what they're actually using, if you look at a lot of these commercials, okay. Phil Mickelson, that's it. Phil Mickelson, how could I forget? But they're using a lot of what I call biological agents. And this is just something, just to give you a little bit of information. A biological agent is basically something that stimulates a normal biological response in the body that does something in regards to that affects inflammation. Okay, and these are a number of agents that they have, Humira and a bunch of other drugs. And that's why when if you watch a commercial now, they'll have that fast talk at the end. They'll say, "Have you had any of these things?" And they reel off, and all of a sudden one of them is tuberculosis. Tuberculosis, people get infected with it, but the tuberculosis bacteria stays hidden, stays dormant until something decreases our immune system, like some of these biological agents. And the reason why the biological agents work with things like psoriasis, rheumatoid arthritis, Crohn's disease, and stuff like that, is that a lot of them are inflammatory based. So if they decrease the level of the inflammation because they decrease the immune response, people get better. And that's what it is. However, they run a greater risk of having a problem in regards to infections and things like that, simply because it does decrease the immune system. And by decreasing the immune response, they're much more likely that these things like the tuberculosis, which is dormant, now becomes active. Other infections now become easier to get. So that's one of the problems with it. But just getting back to this. PS, psoriasis, the typical S sound. Here's a word. This is cervix. Here's a word that begins with a C, cervix. Cervix is the opening of the uterus into the vagina. We'll talk about that as a term later on. When people do a pap smear, when a female has a pap smear, they have to take cells of the cervix to look for cervical cancer. Now this word right here is a C word that does not have that soft. It's not coracoid, but this is coracoid. Coracoid is a little projection that comes right off the scapula, forward right about here, just in front of where the upper arm bone of the humerus attaches to the socket inside the scapula. So that's the exception. That's one of those that doesn't follow the S sound. Soft C, okay? If the word begins with a C followed by an E, an I, or a Y, similar to those vowels we talked about, it has also a soft C or the S sound. The S sound. So cellulitis again. So this is almost like the S that we had before. Cellulitis. Cellulitis. Cellulitis is basically an infection of the skin. That's what that is. So, cellulitis. Cirrhosis. Cirrhosis. So here's a CE, here's a C. I, okay, cirrhosis. And cirrhosis is a damage to the liver, where the liver becomes very scarred and gets very hard, tight, and the liver cells get replaced by a lot of scar tissue. And once liver, has a limited ability to be able to regenerate itself. So what happens is once it's scarred, the scar is not going to come back. So to normal liver tissue, liver gets hard and stuff, and it creates all kinds of problems. When we talk about the GI system later on in the semester, one of the unsung heroes of the body is the liver. I mean, it does some tremendous things that you wouldn't think about. So we need that. So people with cirrhosis have all kinds of problems. So that's cirrhosis again. That S sound, soft C. Cytology. Here's a C followed by a Y. Okay? Cytology. Logi, the study of cyto cells, is the study of cells. So that's that soft C sound. The hard C k sound. The k, or almost like the K sound like we talked about before. If the word begins with a C, but it's followed by all those other vowels of A, O, and U, or consonant, it's most commonly a k, hard C or K sound. Carcinoma, carcinoma. So here's a C followed by an A, carcinoma. Carcinoma just means cancer. Okay? Carcinoma means, oma means tumor, and carcinoma is a cancer, cancerous tumor. Carcinoma, that hard C or that K sound. Colorectal, here's a C followed by an O, colorectal. And colorectal frequently is involving with a carcinoma in cancer. So colorectal involving the colon and the rectum. Okay, colorectal, C followed by an O, hard C or K sound. Curette, curette, okay. Here's a C followed by U. A curette's actually a surgical instrument. It looks like a little ice cream scoop, okay? And whenever you hear the D and C, D and C stands for dilatation and curettage. What they actually did was, now they do it a little bit different. But in the past, they used to have this long scoop. It looked like a little ice cream scoop at the end of a long rod. They take it inside the uterus and scrape off the inside lining of the uterus. But they use a curette to curette out soft bone masses and stuff like that. I used to use curettes to take out even things like warts and stuff like that. But curette, here's a C followed by a U, so it's the hard curette, not a surette, but a curette. Okay, so it's that hard C or K sound that we get with a C followed by U. Okay, Clostridia, Clostridia. Here's a C followed by a consonant. Okay, down here, Clostridia is basically gangrene. Okay, gangrene is a Clostridia. C. difficile is a Clostridia. So there's a number of these. It's a bacteria that actually can be significant. It's sort of very difficult to treat. These are all real difficult bugs to kill. But here's a C followed by a consonant, and so it's a hard C or K sound. Clostridia. Okay, an SK sound. If you have a word that begins with an SK, or some words, again, some, with an SK or SC, or some begin with an SCH, it's sk sound. Okay, let's talk about that. Skeletal. So here's an SK, skeletal. That's easy. Everyone knows what that is. Okay. Scleroderma. Here's an SC, scleroderma. Scleroderma is a pretty nasty disease. It's a connective tissue disorder, and sclero means hard. Derma means skin. And what happens with people with scleroderma, it's not just the skin gets hard. In fact, when you watch these people with scleroderma, what happens is their fingertips come to a point because the end of the tips of the fingers the skin becomes so hard that the fingers actually form almost like a point at the very end, and they get little ulcers in the tip of the fingers. But you know what? That's something you can live with. The problem is it also causes hardening of like the esophagus and other organs. The face gets very tight and pulled back. all kinds of problems. It's a horrible way for these people to go. But anyway, here's an S followed by a C. So it's a scleroderma. It's a typical SK sound. Okay. Schizophrenic. Schizophrenic. Okay. SCH. Schizophrenic. People have the mistaken idea that schizophrenia means multiple personalities, and it really doesn't. Schizophrenia is basically what we call a psychosis. If you take medical terminology too, I've always talked about this. If I teach medical terminology too, I talk about schizophrenia as a psychotic disease, where basically they'll hear voices, they'll have hallucinations, they lose touch with reality. So these people are truly crazy, but they don't know they're crazy because they think that the messages they're getting and the sounds that they're getting, the crazy things that they're doing are perfectly normal. Okay, but here's an SCH. Okay, and it's that schizophrenic. Okay, schizophrenia. Z sound. Okay, the Z sound. Z. The Z. So some words that begin with an X, words that begin with a Z, have a typical Z sound. What I'm talking about. Zygoma. Zygoma. This area of the cheek right here, the cheekbone, is called the zygoma. So here's an omen that doesn't mean a tumor. Zygoma means this is called the zygomatic arch along here, and one of the bones that forms the zygomatic arch is called the zygoma. So here's a Z, typical Z sound. Okay. Now this one right here is there's a Z that sounds like, or an X that sounds like a Z. That's called xanthoma. Xanthoma. Okay? Xanthoma. And basically xanthoma is a yellow tumor. It's in sort of a benign fatty type of a mass. It's called a xanthoma. And this one right here, I put here, but it's actually, it does have a Z sound. It's a xenogram. So basically this does have a Z sound, typical Z sound, xenogram. Okay? A couple other things that we should talk about are possessive terms. I'll just mention some very shortly about possessive terms. And this involves certain things like diseases, structures, instruments. All of these are named after an individual or they have a specific name. John, Bob, whatever the case. Yeah, hey, slap me a Bob. Boom, no, it's nothing like that. So that's that. Or sometimes we have eponyms, okay, where it's a name for a disease, organ, procedure, function that's derived from a name of a person. Okay, there's a particular fracture that occurs in the foot. It's called a Lisfranc's fracture. Actually a Lisfranc's fracture dislocation. So basically, it's named after Lisfranc, who basically described it. So Cushing's disease. Cushing's disease is a disease of the adrenal gland. Cushing described this disease. Okay, and so sometimes these possessive terms, which have someone's name or a specific name made for something, can be used in medical terms, and these don't have a word root, a suffix, and prefix. It's just a special word. We talked about these before, and basically these are very commonly used. I mean, they're tossed around all the time as well. Look at a lot of surgical instruments. I mean, hemostat is easy. Hemo means blood. Stat means stopping, which is easy. But then sometimes they have a certain name for a hemostat, like a coker or something like that, different type of a hemostat. And basically that's named after someone who designed the particular offspring or offshoot of a particular instrument. Okay, so what we've talked about in this very brief discussion has to do more with pronunciation, how we pronounce words. How do we get that? And again, it's important to understand these simply because we do know that medical terminology is not just a written language, but it's also a spoken language. So you have to be able to speak it. I mean, it's great if you're standing there with a bunch of people and you're talking, and all of a sudden you have some crazy word that comes out that's really mispronounced. It doesn't sound very good. So pronunciation, these are just some of the rules that we have for pronunciation. I mean, there are other special words. The more words that you know, they become second nature to you. But that's what gets me when I watch these medical shows and people are pronouncing things incorrectly left and right. It just bugs me. I just turn those things off. That's why I don't watch any medical shows anymore. But anyway, hopefully you got a little bit of an idea about how we pronounce some of these things. My recommendation is that when you go through the words in the book, okay, or in the electronic copy of the book, maybe what happens is say these things out loud, okay, and just to get the use of how they're pronounced. And in the book, if you look at the text, whether in electronic form or written form, there's usually something phonetically spelling how these words are. But these are just some rules that you have in regards to how spelling is done. And so I think that pretty much concludes what we want to talk about today. And we'll be another little video in regards to how do we make plurals. Okay, but that's it for now. Talk to you later. Be safe.